Most seniors believe that once blood pressure starts rising after 60, the only real solution is stronger medication and strict limits on salt. They accept feeling tired, waking up with headaches, and that constant heavy feeling as an unavoidable part of aging. I wish that were true, but it isn't. I've been a cardiologist for over 22 years, treating thousands of patients over 60. Many came to me already on 2 or 3 blood pressure medications, yet their numbers kept creeping higher. What surprised them, and what I'm going to share with you today, is that simple, evidence-based changes in diet can produce real, measurable drops in blood pressure, sometimes matching or even exceeding the effect of adding another pill without extra side effects. My name is Dr. Elena Carter. In this video, I'm going to explain 5 powerful, scientifically proven ways seniors can lower blood pressure through everyday diet. These are not trendy fads or unproven remedies. They are backed by strong clinical research and have helped many of my patients reduce their readings by 8 to 15 points or more within weeks. After 60, your arteries naturally become stiffer, your kidneys less efficient at removing excess fluid, and inflammation tends to rise quietly. These 5 dietary approaches directly target those changes. They improve nitric oxide production to relax blood vessels, help balance sodium and potassium, reduce inflammation, and support better endothelial function, the health of the inner lining of your arteries. The best part? These changes are practical, affordable, and gentle on the stomach. You don't need to follow a complicated diet or give up everything you enjoy. Even adding 3 or 4 of these strategies consistently can make a meaningful difference in your blood pressure and how you feel every day. I've seen patients in their late 60s and 70s who were frustrated with medication side effects achieve better control simply by adjusting what they eat. Some were able to reduce their dosage under medical supervision. Others reported more energy, less swelling in their legs, and better sleep. These 5 ways are not about perfection. They are about smart, consistent choices that work with your aging body instead of against it. They support your heart, protect your kidneys, and help your brain stay sharper. If you are over 60 or you care for a parent or spouse who is, this video could be one of the most practical and helpful pieces of information you receive this year. Because lowering blood pressure naturally through diet after 60 is not only possible, it can be surprisingly effective when done the right way. The first and one of the most powerful evidence-based ways to lower blood pressure after 60 is increasing your intake of nitrate-rich vegetables, particularly leafy greens and beets. After age 60, your body produces less nitric oxide, the natural compound that keeps arteries flexible and relaxed. Leafy greens such as spinach, kale, arugula, and Swiss chard are loaded with nitrates that your body converts into nitric oxide. This helps open blood vessels, improves blood flow, and lowers pressure without putting extra strain on your heart. Clinical studies, including research published in the Journal of Hypertension, show that eating just 1 to 2 cups of leafy greens daily can reduce systolic blood pressure by 5 to 10 points in older adults within a few weeks. Beets and beetroot juice are even richer in nitrates. Multiple randomized trials have proven that drinking 200-250 ml of beetroot juice a few times per week can significantly lower both systolic and diastolic pressure in seniors. The second highly effective way is increasing potassium-rich foods while being mindful of sodium. Most seniors get far too little potassium and too much sodium, which causes the body to hold on to fluid and raises blood pressure. Excellent potassium sources for seniors include bananas, avocados, sweet potatoes, oranges, and white beans. A medium banana gives you around 400 milliliters of potassium, and half an avocado provides even more. Research from the American Heart Association shows that increasing potassium intake while moderately reducing sodium can lower blood pressure as effectively as some medications in older adults. The third powerful dietary strategy is eating berries regularly, especially blueberries and strawberries. These contain high levels of anthocyanins, powerful antioxidants that improve the function of the endothelium, the inner lining of your arteries. Studies have shown that consuming 1 cup of berries daily can reduce systolic blood pressure by 6 to 8 points and improve artery flexibility in people over 60. These three approaches work beautifully together. Leafy greens and beets boost nitric oxide, potassium-rich foods help balance fluids, and berries fight inflammation and stiffness in the arteries. Many of my patients start seeing encouraging drops in their home blood pressure readings within 10 to 14 days when they add these foods consistently. Let me make this very practical for you. You don't need fancy recipes. Start your morning with a handful of spinach blended into a smoothie with a banana and some berries. Have a side salad with lunch that includes leafy greens and half an avocado. Roast or boil beets 2 to 3 times a week as a simple side dish. Snack on a cup of fresh or frozen berries in the afternoon instead of processed snacks. These small changes are easy on the stomach, affordable, and deliver real results. One 68-year-old patient of mine reduced her systolic pressure from 148 to 134 in just 5 weeks by adding a daily spinach banana berry smoothie and eating beets 3 times a week. She felt less bloated and had more energy. Another 73-year-old gentleman lowered his readings noticeably by replacing his afternoon biscuits with a handful of berries and half an avocado. His doctor was impressed enough to delay increasing his medication. The key is consistency rather than perfection. Your arteries respond to what you do regularly, not occasionally. Even if you can only add 2 of these strategies at first, you will still see benefits. These dietary changes also bring bonus advantages: better digestion, more stable energy, reduced swelling in the legs, and protection for your kidneys and brain. Unlike adding another pill, these foods support your overall health as you age. You have now seen the first 3 powerful evidence-based dietary ways that can meaningfully lower blood pressure after 60: nitrate-rich vegetables, potassium-rich foods, and regular berry intake. Each one targets a different reason why blood pressure tends to rise with age, and together they create a strong foundation. The fourth evidence-based way to lower blood pressure naturally after 60 is consuming garlic regularly, especially in its fresh or aged form. Garlic contains sulfur compounds, particularly allicin, which help relax blood vessels, reduce inflammation, and improve nitric oxide availability. Multiple clinical studies, including a major review in the Journal of Nutrition, have shown that regular garlic consumption can reduce systolic blood pressure by 5 to 9 points in older adults. For seniors, aged garlic extract or lightly cooked fresh garlic tends to be gentler on the stomach while still delivering strong benefits. The fifth powerful dietary strategy is increasing your intake of omega-3 rich foods, particularly fatty fish like salmon, mackerel, and sardines. Omega-3 fatty acids reduce inflammation in the arteries, improve endothelial function, and help prevent stiffening of blood vessels. Research from the American College of Cardiology shows that consuming fatty fish at least twice a week can meaningfully lower blood pressure and reduce cardiovascular risk in people over 60. Even if you don't like fish, you can get benefits from walnuts, flax seeds, and chia seeds, though fish remains the most potent source. Now let me show you how to combine these 5 strategies into simple, sustainable daily patterns that work well for seniors. Morning routine. Start your day with a spinach, banana, and berry smoothie. This single drink gives you nitrates, potassium, and anthocyanins in one easy step. Add a teaspoon of ground flaxseed for extra omega-3s. Lunch. Include a large leafy green salad with avocado, beets, and a light garlic dressing. This combination hits 4 of the 5 strategies at once. Dinner. Have baked or grilled salmon or sardines twice a week, served with roasted sweet potatoes and sautéed greens. On other days, use garlic-seasoned beans or lentils with vegetables. Snacks. A handful of walnuts or a small bowl of berries instead of processed snacks. These patterns are not restrictive. They are nourishing, tasty when prepared simply, and realistic for daily life. Many seniors tell me they actually enjoy eating this way more because they feel better and have fewer cravings. One 71-year-old patient of mine followed this approach for 8 weeks. Her systolic pressure dropped from 152 to 136. She reduced one medication under her doctor's supervision and reported much less leg swelling and better sleep. Another 67-year-old man lowered his readings by 14 points just by adding the morning smoothie and eating beets and salmon regularly. The science is clear. These 5 dietary strategies work because they address the root causes of rising blood pressure after 60, reduced nitric oxide, fluid imbalance, inflammation, and artery stiffness. They work gently and cumulatively. The more consistently you follow them, the better the results. Important practical tips. Start gradually. Pick 2 or 3 strategies first so you don't feel overwhelmed. Track your home blood pressure every morning and evening. You will likely see positive changes within 2 to 4 weeks. Choose fresh or frozen produce. Both work well. If you are on blood pressure medication, especially potassium-sparing diuretics or ACE inhibitors, consult your doctor before significantly increasing potassium-rich foods. Season generously with garlic and herbs instead of salt to enhance flavor naturally. These dietary changes also bring wonderful side benefits: improved energy, better digestion, reduced joint inflammation, and protection for your kidneys and brain. Unlike medication, they support your overall health as you age. You now have 5 strong, evidence-based dietary ways that can help lower blood pressure naturally after 60. Nitrate-rich vegetables, potassium-rich foods, berries, garlic, and omega-3 sources. The power is in your hands. Small, consistent changes in what you eat every day can give you better control over your blood pressure and how you feel. You now have 5 clear, evidence-based dietary ways that can meaningfully help lower blood pressure after 60. Nitrate-rich vegetables like leafy greens and beets, potassium-rich foods such as bananas, avocados, and sweet potatoes, regular intake of berries, especially blueberries and strawberries, garlic, fresh or aged. Omega-3 sources, particularly fatty fish, walnuts, or seeds. These strategies are not complicated or extreme. They work by relaxing blood vessels, balancing fluids, reducing inflammation, and improving artery flexibility, exactly what your body needs most as you age. Many of my patients have achieved reductions of 8 to 15 points in systolic pressure by consistently following these approaches, with some even reducing their medication under medical supervision. The real power lies in consistency, not perfection. You don't need to follow all 5 perfectly every day. Start with 2 or 3 that feel easiest for you. A morning smoothie with spinach, banana, and berries, a salad with beets and avocado at lunch, and salmon or walnuts a few times a week can already create noticeable improvements. Track your blood pressure at home every morning. Note how you feel, your energy, swelling, and sleep quality. Most seniors begin noticing positive changes within 2 to 4 weeks. These foods also bring extra benefits: better digestion, more stable energy, reduced joint discomfort, and protection for your kidneys and brain. Remember, diet works best alongside, not instead of, your prescribed medication. Always consult your doctor before making significant dietary changes, especially if you have kidney issues or take potassium-sparing medications. Get your blood work checked regularly to ensure everything stays in balance. You are not powerless against rising blood pressure after 60. Your arteries and heart can still respond beautifully when given the right daily support through food. These 5 strategies are gentle, affordable, and sustainable. They allow you to take an active role in your health without feeling deprived. Start today. Add 1 or 2 of these foods to your next meal. Small, consistent actions compound into real results. Your future self, with steadier readings, more energy, and greater peace of mind, will thank you. Thank you for watching. If this video gave you practical hope and clear actions, please share it with other seniors or family members who may benefit. One simple change shared can improve many lives. This is Dr. Elena Carter. Take care of your heart through the foods you choose every day. You still have the power to improve your health naturally. Start small, stay consistent, and watch the difference.